Okay, morning everyone. Thank you to the symposium organisers for including a session on insecticide resistance in this symposium. What I want to do is talk, obviously we all know that vector control plays a very key role in malaria control across the globe, particularly in Africa. And there's three major interventions, of course, the major one being insecticide-treated nets, also indoor residual spraying, and to a limited extent, larviciding. And these are all reliant on the use of insecticides. And the decline, there's been a very impressive reduction in malaria burden across the continent since the turn of the century. And we can see this data, these figures that have been shown widely during this meeting from the BART paper last year, shows that some spectacular decreases in malaria incidence across different countries. And also, in this study, they looked at the probable causes that were driving this reduction and attributed the majority of the reduction in malaria burden to vector control, particularly due to the use of insecticide-treated nets shown in green here. But these pictures from this study do mask some rather worrying data from the ground. So the continent-wide picture may look quite promising, but when we look home down to look at some specific countries, the data is not quite so positive. So this is data from the National Malaria Control Programme in Burkina Faso, showing that since 2006, there's been a steady increase in the number of malaria cases and really not much impact on deaths, maybe a little decline recently. And that's despite 2 rounds of bed net distribution aiming at universal coverage for the whole population, shown in these arrows here. And this is not an isolated case. We're seeing other reports of areas where there are high burden settings where malaria cases are not going down despite the introduction of the implementation of the WHO recommended strategies, including universal coverage with bed nets. Now, of course, there are multiple reasons why we might be seeing a stubbornly persistent malaria in these settings. But what we're interested in understanding is whether the growing levels of resistance to the pyrethroid insecticides on the bed nets are contributing towards this persistence in malaria. So it's widely accepted that pyrethroid resistance is increasing quite rapidly in African malaria vectors. So the pyrethroids are the only insecticide that can be used on bed nets. And these figures here just show the data from some bioassays trying to measure the level of resistance in a population. So each dot is a different population from different different sites across Africa. The 2 different colours are just 2 different pyrethroids. And it's a time course here. So you can see that on the, sorry, which one's is that the laser?
The pointer.
Yes, yeah. Yes, so this is a time course here, so you can see 20 years or so ago, then most population had 100% mortality in these tests, and there's been a steady decline in resistance, both in the 2 major malaria vectors in Africa. So, and this, again, if we break this down to look at individual country data, going back to Burkina Faso again, we can see that this decline in susceptibility can be quite rapid. So this is data from 5 years of monitoring in a site in southwestern Burkina Faso, where you can see a rapid decrease in the susceptibility to pyrethroids. So although it's widely accepted that pyrethroid resistance is increasing in mosquito populations, but what is more contentious is what the impact of that resistance is on malaria control interventions, and specifically on bed nets. So the prevailing view really is that bed nets are still working despite the presence of pyrethroid resistance. So this is an example of a study a couple of years ago in Malawi, which found that ITNs continue to protect children from malaria despite the presence of moderate levels of insecticide resistance in this population. And those of you that were in the symposium yesterday that presented the results for the 5-country study looking at the impact of insecticide resistance across 5 different countries, the WHO sponsored project, will have seen the conclusions here that there is no relationship between the incidence or prevalence of malaria and pyrethroid resistance levels in the population. And there's also no reduction in personal protection from ITNs in areas with pyrethroid resistance. So this is clearly very good news and tells us that the pyrethroid treated nets are still working in these settings. But what I just want to spend a few minutes just thinking about now is, I guess, the two, the glass half full and glass half empty type scenarios, or the optimist and the pessimist. And is it that we are exaggerating the problem of insecticide resistance, or is it it's a time bomb and we're about to see a massive reduction in the performance of our primary tool to prevent malaria due to resistance? And I think there's evidence on both sides of this. I want to just start by looking at the potential that the way that we monitor for resistance is actually over-exaggerating the impact, or not correctly interpreting the impact. And just to give one data point to illustrate this fact, we measure resistance by looking at how well the mosquito survives after it's exposed to a given concentration of insecticide, and we look at the immediate or the 24-hour mortality. But actually, if you take a highly insecticide-resistant population, and you expose it to a bed net, you get very little mortality. But if you then measure what happens to you look at its longevity, this is the red line is an untreated net, and this is an insecticide-treated net. So you can see that there is insecticide exposure reduces the longevity of the mosquito population. And working with colleagues in the University of Glasgow, we modelled this impact, and we looked at multiple different exposure scenarios and different resistant populations, and found that the lifespan of mosquitoes is reduced by approximately half by net exposure, even if they're resistant to insecticides. And so this so that ITNs will continue to reduce malaria transmission, but even if they're not immediately killed by an insecticide, there will still be an epidemiologically significant impact of the bed nets. And then other studies have looked at other traits that affect vectorial capacity. This is a study looking at the impact of exposure to nets on the development of the parasite, and found some evidence for reduced parasite prevalence and intensity of infection after net exposure. So that's the good news, that maybe there are other factors that we're not measuring very well that means that that resistance isn't having quite the impact that we thought. But on the negative side, it may be that we're not seeing an impact of resistance because we're measuring the wrong thing in the wrong place. And I just want to remind everybody that bed nets work in two different ways. They have a physical barrier, so they provide a personal protection from bites, but they also have a community effect from the insecticide on the nets. So we try to understand a bit more about the impact of resistance by collating data that's collected on the performance of bed nets in these experimental huts where sleepers sleep under hold nets, and these studies have been done in areas of different levels of resistance. And working with Tom Church at Imperial College, using his model of malaria transmission, we attempted to try and predict the impact of resistance on malaria incidence. So firstly, looking at the data from the experimental huts, and this is summarised in this figure here. So we've got increasing levels of resistance across here, and we can see that as you get more resistance, and of course fewer mosquitoes are killed, but you actually only see a reduction in blood feeding, so the personal protection, remember these are hold nets, only is evident when you get to quite high levels of resistance in the population. When Tom put all this into a model of malaria transmission, this is sort of one of the summary slides from his work. And again, looking at increasing levels of resistance here, and this is malaria incidence, you could see that even very small increases in the level of resistance can result in a dramatic increase in the level of malaria transmission. And these different lines here are non-net users and net users. This is the average. And of course, the problem gets more severe when you get to these levels with very high levels of resistance in the population. And it's important to note that many of the studies that we're looking at in the 5-country study are in this sort of area where you wouldn't predict much increase in the level of malaria cases at low levels of resistance. But in areas like Burkina Faso and Cote d'Ivoire, where at this level, we might expect that we've got quite a big increase. You might expect that you would see an impact of resistance on malaria cases. So that's what we're trying to explore now, more in a collaborative project, trying to measure all the different contributory factors that might be contributing to the high burden of malaria in this setting. So not just insecticide resistance, but of course things like net use, access to treatment, and other health system factors, and trying to really understand the impact of resistance in this setting. So to summarise the key knowledge gaps that I think really are around our understanding of the impact of insecticide resistance. Firstly, I think that we that we need to look beyond immediate mortality. For years, we've been doing these bioassays that just look at 24-hour mortality. What we really need to understand, we don't really care about how many mosquitoes we kill, we care about how long those mosquitoes live and how likely they are to transmit malaria. So we need to develop better methods to looking at what happens after mosquitoes are exposed to insecticides to their ability to transmit malaria. And then also, I think there's a lot more that we need to do to establish the relationship between the strength of pyrethroid resistance and the loss of both personal protection for bed nets, but also importantly, the community effect. And I think that it's also important to remember that resistance isn't a binary trait. It's the spectrum, and the strength of resistance is getting stronger every year as we continue to exert more selection pressure. So we do need to look at some of these highly resistant populations, because that's what the future will look like. And just finally, just to say a little word on the future. I mean, so we have got new bed nets in the pipeline, some already in use, some nets now that have synergists in them designed to be more effective against pyrethroid-resistant populations, some under WHO evaluation that have got pyrethroids plus another active ingredient, and others under development that have got completely new modes of action. But we really do need to understand what the impact of resistance to what impact insecticide resistance is having on the performance of our current nets to aid decisions about the design and the deployment of these nets. And just an example of the some of the questions that we need to understand is these nets are likely to be more expensive and they're likely not to be needed everywhere. But we need to understand how to evaluate them, where they should be used, and what's the best resistance management strategy for these nets and other insecticide-based interventions. So I think understanding the impact of resistance on the conventional nets is not just a case of looking backwards. It's really critical for us to address those questions. So I just finished by acknowledging that the modelling work here was done by two groups in Imperial College with Tom Churcher and the University of Glasgow. And the work was supported by AVICNet Consortium funded by the EU and MIRA funded by Wellcome Trust.
We have time for a few questions, if there are any.
Maybe I can. Hilary, you didn't say anything about the fitness of mosquitoes in, wild type compared to pyrethroid resistance. Is that also a factor?
Yes, I mean, I think that this is something that it's always been hoped that if you could reduce if the mosquitoes have a fitness cost and you reduce the selection pressure, that resistance would disappear from the population. But I think with pyrethroids, they've been used so much that you've got compensatory mechanisms to overcome those fitness costs. And also, even if you were to remove the selection pressure, these are used in agriculture, they're used in aerosols, so we can't remove the selection pressure on pyrethroids, I think. Okay.